National Public Health falls under the mandate of the Ministry of Health. However, the mandate of ensuring the maintenance of high-quality service provision by the national and county hospitals lies squarely with the said ministry.
National Public Health Laboratory is a public health facility within the Ministry of Health, Department of Disease Prevention and Promotive Health.
The launch of the National Public Health Laboratory heralds a new beginning in the establishment of a strong pillar in public health.
We are celebrating accreditation of our 3 national reference laboratories, National Microbiology Reference Lab, National HIV Reference Lab, and county laboratories. Accreditation promotes a strong degree of consistency in compliance to medical laboratory laws and legislation, both from an international and national perspectives. Indeed, fundamentally, accreditation is critical in promoting laboratory efficiency and responsibility to better results and service delivery. And that ultimately promote the growth of our customer satisfaction.
This laboratory encompasses 3 main areas: the National Microbiology Laboratory, Medical Equipment Lab, and the National HIV Reference Lab. Each has its own targeted mandate.
Microbiology Reference Lab is part of the division of National Public Health Laboratory, which is under the Ministry of Health. My lab is a microbiology lab, an accredited lab, and it has several things that it does, many functions. One is a clinical laboratory, of which the clinical laboratory is an accredited lab. We have a public health laboratory where we test water, food samples, basically surveillance. Also does what you call efficacy testing. Efficacy testing entails checking the efficacy of the capability of some chemicals to do their work as the manufacturer says. The lab has been accredited on one ISO we call ISO 15189. It's ISO for medical laboratories. This entails the lab being able to actually do technically their work. If it's testing, the sample results that they give for the patient are of high quality.
Center is created for training of in-service biomedical engineers, and also for the students who are being trained on biomedical engineering. They are welcome to the center to come and be attached here. And also the center also offers services to laboratory who need their equipment to be calibrated and certified. The center was established due to the gaps that were existing in equipment management. Most of the equipments were under service contract, and when the service contract is over, the lab equipment were not being serviced at all, and that's why the center was established. Due to new technology, the biomeds are not able to work on the new equipment, and therefore they needed refresher training on the new equipment.
The National HIV Reference Lab has a mandate to help the HIV program in monitoring of the disease and also in testing in diagnostics and also monitoring the treatment. It is also coordinates all the 7 labs in the country which are doing viral load testing, that is monitoring of the ARVs and the early infant diagnosis. So we are taking part in the sample analysis for HIV across the country during the population surveys, like the KAIS 1, which was done in 2007, and KAIS 2, which was done in 2012. Our guidelines have changed that service clients are tested and they are put on treatment. So quality of results is very key.
All these departments are aimed at enhancing health service delivery to the taxpayer, both at the county and referral level. The labs are also meant to mitigate any outbreak of diseases, some of which have previously posed a challenge to the well-being of the public, together with public health personnel.
This lab was opened in 2014 by the Ministry of Health, and our mandate is to conduct specialized testing on influenza A and B, and we also do influenza BA subtyping. We support National Influenza Control Program to monitor the circulating strains of influenza around the country.
Medical practitioners also get to learn the latest trends in equipment and emerging trends in the medical sector. It also ensures that medical equipment are also up to the required standards.
The National Public Health Laboratories, various laboratories have developed quite a number of strategies and guidelines and policies in the last 1 year, and we are launching 8 of them today. And this is in line with the UN AIDS targets of 1990, and we're looking at what our country can be able to achieve within 2019.
Although Kenya has achieved milestone in the fight against HIV and AIDS, the establishment of the National HIV Reference Lab will ensure proper and accurate medical tests and enhanced intervention for victims of this pandemic.
The good news for our country in laboratory practice is that today we have invested and established a level 3 laboratory that has capacity to handle Ebola and any other organisms graded as level 3 organisms.
It is a new dawn in the medical sector as we enter a new phase in service delivery. People-oriented and result-based endeavors which will ensure a healthy, wealthy nation. A healthy person is a wealthy one.